This is a demonstration of how you can use Quillr for fetal medicine reporting. Let's take an example. If you want to create a level 1 ultrasound report, so first step would be you select your own templates to start with, but you can also report on Quillr without any template. Just speak the finding and the study that you want to report. Let's try one. I'm reporting a level 1 ultrasound for a 36-year-old female patient. The NT measures 4 millimeters. Make a report and give me the risk assessment for this patient. Now Quillr will print a report using its own pre-built templates. But if you want to use your own, you're free to do that. So it told me that the NT was increased for this age, and this is the possibilities of pathologies that can be there, and what the recommendations for the next workup should be there. Because I asked for the risk assessment. If you don't want to do that, you can just speak your own impression or your advice or your recommendations. So that was if we did not use our own templates. Now let's take an example. If we have our own template, so suppose this is my template for the one that I use for my ops cases. One way is to press your mic button. You can also use Quillr on your mobile phone, that you can turn on the mic and put right next to the patient while scanning your patient on the machine, and speak out your findings. Cephalic presentation, FHR 150 BPM, BPD 19 centimeters 36 weeks 5 days, HC 8 centimeters 36 weeks 6 days, placenta posterior grade 3, cervix 3 centimeters, AFI 20. So you will have to speak out all the values and will populate them in the table and everywhere they're supposed to go. This is a more tedious way where you'll have to speak out all the findings manually, and will keep populating in all the tables and wherever they're supposed to go. But in the next example, I'll show you how you can also automate this if you just give it a picture of your final chart. So this is one way how you can make your reports of ops cases. But let's take another example. If we want to do that automatically, so another way to make your ops cases is that in the side panel, you can give a picture of the final chart that you usually get. So for example, this is your ultrasound machine. You just take a picture of the final chart where you have recorded all your measurements of biometry. I'll take a screenshot of this, or you can upload this image also. If you get this on your computer, you can either attach an image, like by clicking this button, you can paste this here, or you can directly paste the picture here and ask, can you please extract the text, and press enter. It will extract the text from the photograph and make a detailed report. You're trying to make this even more faster by adding just a button where it will add all these values into your table and your template. But till then, this is the way you're supposed to do that. So once it has extracted all the text, I'll just copy all of this information. I need to press this plus button and paste my information here, and I press update. So all these findings will go into my template in the relevant places. So I don't have to speak my values, my biometry, and all those other things. So you can see all of these being automatically populated. So all my values are here, and if you want to make any changes, add or remove, just talk to it and you can make your changes here. Cervix 3 centimeters, AFI 20. So the things that are not recorded on this chart, you can just speak them out. And this area also highlights anything that is missing within your report in case you missed out on any field that is supposed to go in there. Let's check what this gives us. So this area is reviewing and telling me what all things are missing. Cervix length is missing, and impression does not have the AFI values. Okay, so cervix length is missing. Okay, it did not understand if I mentioned the cervix as 3 centimeters, so which it misunderstood as something else. So largest pocket, put that into. That's how you're supposed to do it for your ops cases.